The Mayor de Blasio says that the city is ready to roll out Moderna and J&J vaccines as soon as they have approval, and you may be able to choose which booster shot you get. The FDA is expected to approve mixing and matching booster shots by the end of this week and will likely give full approval of both the Moderna and J&J boosters by tomorrow night. The CDC's advisory panel will then meet Thursday to make its own recommendations. Full FDA and CDC approval could come by the end of this week, immediately expanding booster eligibility for tens of millions of Americans. Last week, the FDA's independent panel unanimously recommended Moderna boosters 6 months after full vaccination for vulnerable adults and those 65 and older. They recommended J&J's at least 2 months after the initial dose for adults 18 and older who got the single shot. Approving mix and match boosters will give healthcare providers greater flexibility and access. And the science so far is standing behind that. A new study by the National Institutes of Health found that people with the J&J vaccine who received a Moderna or a Pfizer booster shot had significantly higher antibody levels compared with those who got a J&J booster. The FDA's advisory panel weighed the pros and cons while debating the study's findings on Friday.
I just want to point out that this is going to be some very, very messy in terms of the messaging. I want to make sure that we don't confuse the public even more than we are already.
And on the other hand, we have to follow the science. We're still in a pandemic here, and if there's opportunity to offer benefit, that's our job.
The FDA and CDC gave full approval to Pfizer's booster shot last month for adults 65 and older and those who are at risk. The FDA says that it will not recommend one specific shot over another for boosters. Reporting live on the east side, I'm Katie Corrado, Pix 11 News.